After record highs in COVID-19 admissions over the last couple of weeks, the regional hospital seems to be trending in the right direction. The hospital has fewer infected patients, although more are now in intensive care, mainly those who are unvaccinated. Here's Corey Nordstrom with the latest details.
The number of patients admitted to the Thunder Bay Regional Hospital with COVID-19 has finally seen a significant decline after seeing record numbers as high as 52 on Tuesday. Going into the weekend, hospital officials announced they have just 43 COVID-positive patients. 9 of those are in the ICU. Hospital capacity is now at 101.5%, with ICU capacity at 86.4%.
It's been the most significant and sustained highs that we've seen over the past 10 to 14 days, so that's been a little bit new to us. That said, we are seeing those numbers come down a little bit. It's the last couple of days that we've only seen single-digit admissions for COVID-19.
But Crocker-Ellicott says one important piece of information is not seen in their daily reportings, and that's the effect of COVID-19 on people no longer deemed an active case.
That doesn't necessarily account for individuals that continue to remain in hospital once their COVID infectious disease period clears. So although there are 9 COVID positive in ICU, very often we have a few additional patients in ICU or in other parts of the organization that still require care for COVID-related illness. And as of yesterday, for example, that number was 29.
The hospital's CEO is hopeful the downward trend in cases can be seen across the province and they can soon get back to doing non-urgent surgeries.
The thought is that the province may shift that directive to in a phase 2 approach. So hoping to see mid-February, late February, maybe see some resumption of some of that surgical and procedural care that's been put on hold.
Crocker-Ellicott is also urging the public to get their COVID shot, as 62% of intensive care patients are unvaccinated. Corey Nordstrom, TBT News.